Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Dr. Sara Bennett speaks with Dr. Indu Bhushan. Dr. Bhushan is the Chief Executive Officer of the National Health Authority of India and also the CEO of the PMJ, a program that aims to provide free hospital services to the poorest 40% of India's population. Dr. Bhushan holds a doctorate in health economics from the Johns Hopkins Bloomberg School of Public Health, and prior to joining the National Health Authority, he worked for the Asian Development Bank and the World Bank. They speak about the COVID-19 pandemic and the health system in India. Let's listen.
So, Dr. Bhushan, thank you so much for joining me today.
Thank you. Thank you for having me.
We're now seeing large and growing numbers of people testing positive for COVID-19 in India. I wondered how that was translating into demand for health services under the PMJ scheme.
Actually, it's ironical that while the COVID is expanding, demand for health services under PMJ has actually gone down. What is happening is that people don't want to visit hospitals unless absolutely essential. Of course, there were some restrictions on travel as well, and that also prevented people from going and using services. Number of hospitals had closed or scaled back their operations. That all meant that about our demand had gone down by about 70%. On the other hand, demand for, of course, COVID care has ballooned, increased a lot. I give you just for India, give you some numbers. When the pandemic started, we were doing 100 tests per day. Now we are doing 400,000 tests per day. There was only one center which was doing testing. Now there are thousands of centers which are doing testing. Similarly, the ventilators or the ICU capacity has gone up tremendously. But COVID in PMJ, we've done more than 18,000 treatments and more than 38,000 tests. So that demand for COVID actually is increasing. And one particular thing is about migrant workers. A lot of migrant workers actually had gone and they're going back to their home villages and hometowns. And for them, the COVID care and non-COVID care both is increasing under PMJ.
And for the migrant workers who are traveling from the cities back to rural areas or other towns, there's portability of the scheme, yes? They're able to get their coverage wherever they are throughout the country.
Yeah, so the portability has been one key feature of our scheme, that even if you are from, say, state like Bihar, you could go to Mumbai or any other place where services are available. And this has come in very handy for migrant workers. And migrant workers living in bigger towns have been able to use services. And even when they came back or they were in between, they could use services. So we are trying to emphasize this portability feature because, frankly, many migrant workers don't know that this service is available. So we are using this opportunity to spread the message and increase awareness.
Excellent. I wondered also whether the services provided under the scheme for COVID-19 care are being provided free of charge, or are people having to make co-payments for them?
Well, under PMJ, of course, they are free of charge. And for both testing and treatment is free of charge. And even outside PMJ, government services are free. Government services for both testing and treatment are free. But if you go to private hospitals, of course, you have to pay. But many states actually have now put a cap on the pricing for both testing and treatment that is to prevent exorbitant prices some of the hospitals were charging.
Thank you. You also mentioned, Dr. Bhushan, that the demand for non-COVID services had dropped considerably, particularly during the lockdown. I wondered if you had noticed, since the very strict lockdown has lifted, whether there's any increase in demand for non-COVID services under the PMJ scheme.
I think that is still a cause for concern, because what has happened was that during the lockdown, the demand for services went down by about 70%. But the good thing was that for critical care like hemodialysis, chemotherapy, demand didn't go down that much. For example, all the elective surgeries, demand went down by 90%, 95%. Almost there were no knee replacements for 3 months. But hemodialysis went down by 6%, chemotherapy went down by about 20%. But after the lockdown was lifted about a month ago, slowly we are increasing the use of services. And right now we are at the 70% of pre-lockdown numbers. And there are some states that have done way better. Other states have not done better, depending on where the COVID actually has been more prevalent. But also we've seen that private sector has been much quicker to bounce back as compared to public sector. The reason being that public sector still is focused on COVID treatment, and many of the hospitals in public sector have actually been designated as dedicated COVID only hospitals. So they're providing only COVID treatment. Therefore, they have not been able to provide non-COVID services. But the private sector actually has bounced back quite well.
That's really interesting. It was something I had wanted to ask you about in any case, in terms of the role of the private sector, which is such a significant provider of services within India. I know that PMJ purchases services from the private sector as well as from the government sector. And I wondered, from your perspective, how the private sector had responded to COVID-19, and in particular, whether you were finding that empaneled private hospitals are open for services and ready to receive COVID-19 patients or not.
The question I can't answer in the one sentence here, because things are different from state to state. But in general, what has happened is that the initial government policy was that we will promote public sector for providing COVID services. And if any private sector hospital wants to provide COVID services, they have to dedicate the entire hospital for COVID treatment, because they didn't want cross infection, people coming with some different health conditions, and also some COVID patients. So intermingling was not allowed. And so most private sector hospitals didn't come on board. But slowly, as non-COVID treatments have also not been, like, people are not coming with non-COVID health conditions, many private hospitals have started to provide COVID treatment. So right now, there is a very strong support and capacity under private sector for treatment. Same thing was in testing. In the initial phase, it was only public sector labs which were providing testing, and private sector actually was not allowed to provide testing. But later on, also there was a problem with the reagents and the equipment that the private sector didn't have. But slowly, private sector actually has grown, and now capacity under private sector has grown, and now large proportion of testing is being done in private sector.
Thank you. That's really interesting. I wondered also, we were talking earlier about the migrant workers and many of them returning to their home villages or hometowns. And I wondered what kind of access they typically had from those settings, and whether there were empaneled hospitals that they were able to access, or do you think they're seeking care from other types of sources?
Well, if they are beneficiary, or they are in our list of beneficiaries under PMJ, they are surely taken care of. But we've also found that there are gaps in terms of our list. There's several migrant workers who may not be in the list. So, of course, they'll have to find treatment elsewhere. But we have not heard about anyone being denied treatment. And as I was saying earlier, that at least for COVID, there is a strong capacity within a public sector to provide free treatment. And that, of course, is open to migrant workers as well. So we don't see a problem on that account, Sarah.
Excellent. And you just described how initially the private sector had less capacity to provide COVID-19 related services, and yet how that has changed over time. And I wondered if you had any insight as to why that had changed and why private hospitals had become more prepared to offer COVID-19 services. Was the government involved in supporting that, or did they really organize that themselves?
Well, the thing is that, this is a pandemic where there are no playbook. We are actually evolving as this is unfolded. So it is true for also government regulations as well as the response of the private sector. Because as private sector has known more about the disease and how to treat, and there's less panic, there has been a better response from the private sector. Also regulations have changed in terms of what kind of services they can provide and how they should structure these services. So both from government side and private side, there has been a learning curve. And so that has led to greater involvement of private sector in recent time.
Thank you very much. Maybe I can go on to a slightly broader topic and probably my last question that I had wanted to put to you. India is in the middle of some quite significant health reforms aimed at achieving universal health coverage. And PMJ is one part of that much bigger puzzle. I wondered how you thought COVID-19 might affect the priorities for health system strengthening in India going forward.
Well, to be very frank, while COVID has been a big tragedy and it has created a lot of problems for everyone concerned. But as far as the health sector is concerned, I think it has been, if I can say, the blessing in disguise, because there is a greater attention on the health system and investment in health. India invests about 1.2% of GDP on health, which is one of the lowest in the world. And I'm sure that with this pandemic, we are going to be increasing the investment in health. There are also a large number of announcements which have been made. We are going to be strengthening network of labs. We are going to be increasing bed capacities and surveillance system in the country. There was already some effort in place to strengthen human resources, training and availability, and so that will be accelerated further. There is also some stress on increasing investment, private sector investment in tier 2 and tier 3 cities and urban rural areas for healthcare facilities. And more importantly, there was an announcement for having a national digital health mission where we are going to be working on digital part of health, giving all the health professional an ID, every Indian and a health ID, and moving towards electronic medical records and personal health records so that quality of care could be improved. And finally, there is an expansion of telemedicine and a subject on which we've been discussing for a long time, but this crisis has given it a different dimension altogether. And we are seeing expansion of telemedicine and all the associated regulations and legal provisions are being put in place in an accelerated manner. So, summary, a lot of reforms, and this has actually hastened the pace of all these reforms.
Yes, I mean, it's such a disaster in many senses, both economically and in human health terms. But it's good to hear that maybe there are some positive things that might come out of this situation.
Yep.
Dr. Bhushan, thank you so much for joining me here today. It's been a real pleasure talking with you.
Thank you, and have a great day.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.